Okay. Afternoon, everybody. Thanks for joining us. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. Recognize today we've learned of 21 new cases of COVID-19 in Winnipeg, 273 cases in Winnipeg over the last 7 days, and currently 117 variant of concern in the city of Winnipeg. I mention these things and these numbers just to remind all Winnipeggers, continue to be vigilant, continue to stick to those fundamentals of washing your hands, wearing a mask, and watching your distance. And as always, would encourage Winnipeggers to continue supporting local to the extent that you can. We've got a couple of brief COVID updates for you this afternoon. Leisure Guide aquatic programming will resume this spring, and the spring 2021 Leisure Guide swimming brochure will be available online as of April 13th, 2021. I'm happy to also confirm that with the exception of Eldon Ross and the St. James Civic Centre, city pools are now open at 25% capacity for aquatic sports groups, lane swimming, aquatic fitness classes, and limited public swimming. Residents are encouraged to please book 2-hour swim and fitness blocks prior to arriving at the facilities, as there's no guarantee of available blocks for registration upon arrival. Also, I want to update you all of development over the weekend. The provincial government reached out late last week for urgent staffing assistance at the RBC vaccination site. The city was happy to answer the call to support the provincial government. I've had recent questions about the level of collaboration between our governments, and I think this is a good example of our governments working together. Before handing things over to Jay, I want to specifically mention two openings that I helped mark earlier today. First, I was very pleased to officially open the $9.3 million Bill and Helen Norrie Library. This new 14,000 square foot facility will better meet the needs of the community, offering fully accessible multi-use public space, tutorial and programming rooms, improved study and leisure areas, a 24/7 book return chute, accessible parking, and proximity to public transportation. The library's design responds to community feedback received during the planning process, including an outdoor reading deck and programming area, double-sided gas fireplace, children's area with 3 reading nook playhouses and a family literacy playground, non-gendered universal washrooms, single floor layout with 2 real moss feature walls on the interior. And I might also just note the new library recognizes and provides educational information about Roostertown and Pecan Town. This was something that was a result of extensive discussion and dialogue and input from the families of Roostertown. I've participated in direct discussions with many of the families, and I was out at the facility today, both on the exterior and throughout the interior of the library. There's a tremendous amount of recognition and educational for all Winnipeggers to recognize Roostertown. So I want to thank everybody involved, our public service, our Indigenous Relations Division, and of course the families of Roostertown in particular. Bill was a member of Winnipeg School Board in 1964 and then Winnipeg City Council in 1971, the year I was born, before becoming mayor in 1979. Helen Norrie spent 20 years as a teacher and a librarian while putting forth continuous efforts towards promoting children's literature. Together, they were both incredibly big proponents of what libraries can do for our community. And to add to their efforts on libraries, Bill and Helen have been championing Winnipeg for decades. So it's very special to be able to recognize their contributions to our city in this way, and to be joined by Helen Norrie, along with my council colleagues, Councillor Sherry Rowlands and Councillor John Orlico, our Deputy Mayor, who is an incredible champion of this project. The library is now open to the public for pickups and holds and returns. Also this morning, I was pleased to help mark the reopening of the Bonnie Vital pool after $2.9 million in upgrades approved mainly through the 2019 capital budget. with dollars approved in both 2017 and 2018 as well. The upgrades include concrete repairs and retiling of the pool deck, as well as the tank itself, as well as upgrades to the pool filtration system and the heat recovery ventilator system, which regulates the humidity in the building. So hopefully users of the facility will benefit from those improvements. The public is, or the pool, I should say, is now open for public use and will operate at 25% capacity in accordance with the provincial public health orders. Those are some updates. Happy to answer questions on those other COVID issues with Jay after he's provided you with the update. Over to you, Jay. Thanks.
Thank you, sir. Good afternoon. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management for the City of Winnipeg. Our indoor pools reopened today for aquatic sports groups, lane swimming, aquatic fitness classes, and limited public swimming with 25% capacity limits. This includes the newly renovated Bonvitel pool, which received much-needed upgrades, including mechanical and structural repairs, to ensure the pool can be used for years to come. Today, we are pleased to announce the City of Winnipeg will be resuming Leisure Guide swimming lessons this spring. The Leisure Guide swimming brochure will be available on the City's website on April 13th. Beginning April 20th at 8 a.m., Winnipeg residents can register for swimming lessons online using Leisure Online by calling 311 or in person at 395 Main Street, Monday to Friday, 8:30 to 4:30. Swimming lessons will begin as of Sunday, May 9th, 2021. The lessons will have staggered start times and end times to help reduce any congestion at the entrances and exits. I would also, at this time, like to take a moment to acknowledge the work of members of the Winnipeg Public Service that provided some support this past weekend at the province's vaccination site at the RBC Convention Centre. So thank you very much. At the province's request, we were able to quickly deploy staff to fill some spots to help out in the navigator role. So our employees helped support the clinic as navigators to help guide residents with the vaccination site. I'm incredibly proud that we were able to step up to provide support. And now we can take your questions.
All right, we'll start with Jeff from CTV. Do you have any COVID-related questions?
Just how many staff? Sorry, I might have missed that over the weekend.
Sorry, can you repeat the question? How many
staff members in the city?
I think it was approximately 75.
Thanks, that's all.
James from Winnipeg Sun.
Yeah, good afternoon. Jay, where are we at in terms of getting vaccines for emergency responders?
Yeah, great question. So we're working collaboratively with the province behind the scenes. We're working with all levels and branches, and we're fighting every day. Our licensed medical providers who are first responders, paramedics and firefighter paramedics have met the eligibility criteria, but we are still working to get our police officers vaccinated and to start working about and thinking about critical infrastructure and essential workers like our transit operators. So we're working behind the scenes and collaborating with the province to try and get that done, and I'm hoping that we can have some positivity there very soon.
I'll just add to that. I mean, we've been advocating, as Jay's mentioned, we've been advocating since last year for the province's vaccine rollout plans to include our essential workers, as well as to really account for the needs of our unsheltered and homeless in the city of Winnipeg. You know, the province is apparently following the NACI guidelines, and there is a risk of exposure to personnel like Winnipeg Police Service, firefighters and ambulance workers. And so we want to make sure that they're in their plans. We haven't been prescriptive in where they should be, but just rather they should be part of their plans. They are at increased risk of exposure. We want to make sure we're doing everything we can to protect our valued employees, and we'll continue to advocate on their behalfs in discussions with the provincial officials, which are ongoing.
Great, thank you.
Joanne, Winnipeg Free Press.
Hi, just to be clear on that last point you made, I thought that it had started for paramedics now, that some of that had been done in the priority list. Can you refresh me on that? I feel like I've been told that paramedics.
Yeah, paramedics and licensed medical providers have been included in the provincial rollout, and many of our fire paramedic service staff have been able to book vaccines and start getting their shots. But it doesn't include our Winnipeg police officers who routinely are at risk and who are routinely doing work in the community exposed to people with COVID-19. And our police officers, our police force, across Canada are starting to get vaccinations, and we are just strongly encouraging our province to really support our Winnipeg police and other police services, because they're part of the solution, and they're the ones that are protecting us, and we need them vaccinated as soon as possible.
And for bus drivers, there's been a few calls now for bus drivers to get on the vaccine priority list. Are you pushing for that as well at this point?
Absolutely. If you want to keep an economy moving, you need your transit. And we need our transit operators vaccinated as soon as possible. I recognize the very challenging decisions and that the province has to face in terms of deciding who gets vaccinated. I understand the job, and it's incredibly challenging. But I would say that protecting critical infrastructure in terms of our transit operators and our water treatment plant operators and all of our essential workers that may or may not work for the city are part of the NACI Accord and documentation, and we're looking forward to when we can get information of when these essential workers will be vaccinated. It's critically important. As we see more variants of concerns, the risk is increasing. As you know, the science is starting to come out about the level of illness and mortality rates for the variants of concern. And we need to be able to protect our services. And so does the government of Manitoba. They need to be able to protect their services as well. So we would encourage them to continue to work to define and help us with essential workers. And again, they're doing a good job. They've ramped up and they're getting lots of needles and arms. And I was at the RBC Convention Center over the last couple of days, and I would just want to give thanks to the province. I know they got a tremendous amount of work to do. And we're really hoping to continue to work collaboratively with them to get these folks vaccinated.
And sorry, just to be clear, you were confirming then the ask is not just for police, fire, paramedics, which has already started on the paramedic side, but it is to also include those transit workers, Winnipeg Transit.
Yeah, absolutely. I'd like to see our first responders holistically be completely covered and have our Winnipeg Police Service immediately be provided vaccines. And then I want to move on to all of our essential workers that aren't in that first priority list as first responders. It's incredibly important for us to be able to protect those that answer the call when you call 911. And right now, our police officers are doing a tremendous job answering those 911 calls, and they're going into situations where there are COVID-positive patients everywhere or exposed to people who may be symptomatic. And we need to protect them.
Joanne, I mean, the ask of the provincial government has been made since last year to really ensure that essential workers are part of their plans. We haven't, again, been prescriptive about where in the plans, but for goodness sakes, police officers should be part of the vaccine prioritization. They are at increased risk of exposure. The federal NACI guidelines, which the province is saying they prescribe to, does include law enforcement. We see law enforcement being provided vaccines in other provinces. So they are at risk of exposure, and they should be somewhere in their plans. But we've also been advocating for other essential workers, including transit, as well as in the broader community, unsheltered and homeless Winnipeggers. We see in other communities that particular segment of society, which is at greater risk at the best of times, getting vaccines, and that's not happening yet in the city of Winnipeg, in the province that we're aware of. So we're going to continue to advocate for them.
I don't know if we're still rotating or how we're doing it.
I think you're the
Someone
only
else
one
can
with
go.
questions left, so.
Yeah. Why don't you keep going, Joanne?
Okay.
If you have others.
I'm just wanting to not lose the thread of what happened at the RBC Convention Center there. I think you said 75 staff before. I'm just checking my notes. And what were they there for? Why were they called to the site?
Yeah, so great collaboration with the province in a whole bunch of different areas and logistics. And the province asked if we could support with some customer service support in what they call a clinic navigator role, just to be able to help. The province has done a great job. If you check the website, you can see that the province is given way more vaccines, and we were just providing a little bit of that additional support. So that we can help. A lot of the folks that are showing up right now to get vaccines have some mobility issues. Some of our seniors and folks that may be challenged to be able to move around as spryly as maybe you or I, Joanne. So we were there to help support and make sure that things were done smoothly, and we were happy to do it.
So was this a one-time thing then? Was it because there was a crowd at the site, or why did they need city help on that?
I think you'd probably want to more talk to the province in terms of all of the logistics there, and we work with the province on logistics on about 250 other files right now regarding to the pandemic. We're helping them with traffic and a whole bunch of other things. So great collaboration, and we'll continue to work with the province to be able to support all Winnipeggers and Manitobas get as many needles and arms as possible. I am quite concerned about the variants, and I am quite concerned that we need to keep this momentum going, and we are here to help the province in any way possible to make that happen smoothly. So,
I'll just add to that, Joanne. I want to acknowledge and recognize the nimbleness of our public service, the ability to respond in short order. The request was made, I believe it was Friday morning, for assistance later in the day, and they needed help, and we were there to provide the help and throughout the weekend. And so we'll be there to continue to have dialogue with provincial officials to see where we can continue to provide them with the support that they've requested. We all have the same objectives of ensuring the health and safety of our residents, and this is the kind of collaboration that we want to see where it's appropriate and we can be of assistance.
I'm sorry, so this was Friday when it got really busy and there were big lineups. So navigating the way through the site, was that helping people keep spaces in line who couldn't wait that long, or what were they doing beyond that a sign in the building or whatever could?
Yeah, it's probably best that you go to the province to get more information on what the direct role of a clinic navigator is. I don't have the job description here in front of me, but we were working for the province and in collaboration and part of their team, and just supporting anywhere we could to be able to help some of our Winnipeggers and Manitobans that were coming in to get vaccinated. We did see that there was some lineups. And, the province has done a good job trying to ramp up, to 4,000, 5,000, 6,000 doses a day. This is quite a feat. So being able to logistically support, we were happy to help. And we're working collaboratively with them right now on testing sites and traffic management and signs and a whole bunch of other kind of files. And we're just happy to be part of this team.
Okay.
James,
Is
do you
it an
have any
ongoing
other
thing?
questions?
Is it a one-time thing, or is this going?
Right now, we're working with the province to see if there's any other support that we can help out with, and we'll let you know if there's any more collaboration going on. There's lots of work going on in the background. So
There's ongoing dialogue, Joanne. So when and if there's an update, we'll be able to provide it to you, and I'm sure provincial officials can as well.
Okay.
James, do you have any further COVID-related questions?
No, just political questions.
Okay, Joanne?
I have a couple more COVID if we
Sure.
can get those done first.
Go ahead.
If that's your plan. I guess with Jay Shaw needing to go probably. So what is the total number of transit workers now that have had COVID-19?
Oh, great question. I don't think we break it down into department specifics because of identifying health, but I can give you the across all city departments information that we have. As of March 25th, we have currently 3 active employees with COVID-19. Currently, we have 33 who are self-isolating, and the total positive since the beginning of the pandemic is 168. This includes all kind of city departments, including Fire Paramedic Service and Winnipeg Police.
Okay, and can you just touch upon quickly, the number isn't given because of, is it privacy concerns? Why doesn't the city report for departments?
Yeah, one of the main reasons, Joanne, is because some of our departments are quite small, and it may be for privacy and reasons. We just want to make sure that we're protecting. There is still challenges, as you've heard from the province, in terms of stigma. Our employees are tremendously valued, and we just want to be able to work with them and help them through their isolations and when they are sick. And we're just doing our best to make sure that we're taking care of them. We have a team of individuals in our occupational health and safety branch that work with anyone who's been diagnosed, and we just want to sort of keep it at that level. But I can tell you that, like I said, 168 total, and now that we have these variants of concerns, it's important that if you're eligible, you get the vaccine, and it's super important that we continue to follow the fundamentals because the risks are the same or increasing for all levels of government and for all Winnipeggers and Manitobans. So,
okay, and do we know the total number of COVID-19 exposures that there's been on city buses?
oh, geez, I would have to get back to you. We can work with our communications department to get that list. I don't have that in front of me.
Okay. And then, do we know how many, I know there was a list that the province put out in terms of variants of concern exposures on buses. Do we know if that's the entire amount, or are there more than what they've?
Probably a question for the province, but we'll get our communications folks to reach back to you to take a look and see what we know about transit exposures.
Joanne, if I understand your question, though, I mean, the updates we're getting are from the province, so
Correct.
There wouldn't be additional data that we would have as a municipal government. All that information is.
I didn't mean that you'd have your own source. I just meant, are you tracking sort of overall number of transit exposures or that sort of thing? Because they report all the different exposures, so I'm just curious if there's a number. Okay. Thank you.
Yes. Well, that concludes the live stream portion.
Thanks, Jay. All right.
Okay.
Oop, didn't get any there.
Okay. We'll let Jay get out of here, unless he wants to answer these questions.
One day you should let me.
I would probably get better answers.
Have a good day.
Okay, thanks, Jay. Okay. If you have other questions, happy to do my best to answer.
We'll just open this
Yeah.
up to Scrum format.
Hey, James.
Yeah, good afternoon.
Good afternoon.
So I'm not sure if you've seen the letter, but Alex Forrest and UFFW have lawyered up and they're getting ready to sue and in the matter of the North End 4 incident. And I'm wondering, A, have you heard about this? And B, are you concerned that either you or the city could be on the receiving end of legal action?
No, I haven't seen the correspondence you're referencing, so I'm not going to be able to provide comment on it.
Okay, fair enough.
Could I jump in with a different topic? Is
Yeah,
that
hey,
okay?
Jeff.
Yep.
Hi. Matt Allard, your infrastructure chair, would like to move school zone photo enforcement revenue out of the police budget and move it towards making safety improvements in places where he calls hotspots, where people are still speeding even though there's enforcement being done in some of these school zones. obviously a lot of infrastructure changes, I guess, is what he's pointing to. What do you think of that idea of using the revenue there for safety features instead of going to the police budget?
You know what? I'd refer you to Councillor Allard to speak the motion. I understand that the motion will be going to his community committee, and so I'm going to look forward to hearing the discussion that happens at the community committee. And if the matter moves forward, I believe the next step is it would come to Executive Policy Committee, and if so, I'll have an opportunity to look at it and have some dialogue with Councillor Allard and my council colleagues in advance of that meeting. So it's not something that I've looked into in any great detail yet. So I'll let the community committee do their work, and we can go from there, Jeff.
Are you concerned about that taking away from the police budget, though? Because as far as I found the budget, I can't find a number on how much was raised just from school zone enforcement, but you'd imagine it'd be a sizable amount of revenue they'd lose.
Yeah, I mean, that's the kind of detail that I would, if it does advance to Executive Policy Committee, that's the kind of detail that I'd be looking to see what's available to us right now, and what information could we possibly request the public service, just so we can make smart decisions going forward. So, I haven't had an opportunity to spend a significant amount of time looking at the motion or having discussions with my council colleagues on it yet. So I think if Councillor Allard, who I know is very passionate about road safety, and that's why I've appointed him the chair of IRPW, I'd like to let the community committee do their work, and then I can weigh in at the appropriate time if it moves forward.
Okay.
Any further questions?
I do not. I defer to Joanne.
I think that's it for me.
Yeah, okay. Thanks, guys. Have a good afternoon.
Thank you.
Thanks,
You
everyone.
bet.